I am Dr. Kelly G. Williams, MD, OBGYN at the Murfreesboro Medical Clinic. Today we're going to take on a very common topic called Polycystic Ovarian Syndrome. Many people hear it called PCOS. Oftentimes patients are concerned about fertility, but there also is a concern about cancer. So PCOS has two essential moves to it. One is cancer, one is infertility. My first question that I ask patients is, what is your concern? Are you trying to get pregnant right now? If yes, then we're going to take one road. If you say no, then we're going to take the road to prevent cancer. The best way to describe to you polycystic ovarian syndrome is, if you can understand that an egg is like a jet going down the runway. What happens is the jet gets to the end of the runway and takes off. If there's too much estrogen around, the body will say stop because it doesn't need any more estrogen, and the egg is what's producing estrogen. What eventually happens is, as you go a jet going down the runway and taking off, you end up with a bunch of planes that get caught on tarmac. In the ovary, what happens is you get a lot of little small follicles around the ovary and they can't release, making it more difficult for the next one to release. The problem with this is patients don't have a period. This is the cancer part. Their lining can thicken and thicken and thicken until it can lead to a cancer. We treat those patients who don't want fertility at this point with birth control. The patients that do want fertility, we can try to choose two different drugs to help address the issues of infertility. One is a drug called Clomid, which blocks estrogen receptors, therefore letting the egg get bigger, therefore allowing it to ovulate. It does this by tricking the body into thinking there's not enough estrogen around, therefore allowing the egg to make more estrogen, get larger, and therefore ovulate. The second drug is called Femara. Femara or letrozole actually works a little differently in that it blocks the conversion of other hormones to estrogen, and as such, allows the egg to get bigger and release. People will hear oftentimes that I have PCOS and I was told that I could never get pregnant. I don't look at it that way. I look at it as you're giving me a challenge to get you pregnant. And PCOS patients sometimes have difficulty getting pregnant. It is part of it. But I will tell you, one of the things I work with hardest in my practice is making sure that PCOS patients can get pregnant. The one thing that PCOS patients and infertility patients both need is hope. And that is the one thing that here at the Murfreesboro Medical Clinic we will give to you.